Questions, please.
Mr. Vice President, that poster right there, it says to avoid crowding, consider rearranging large activities. So will the Pence-Trump campaign suspend campaign rallies and other activities?
I think that'll be a decision that's made literally on a day-to-day basis. I thought Dr. Fauci spoke to that yesterday very well, that we're going to, I'm very confident that the campaign will take the very best information and make the very best decision going forward. But these proposals are things that every American can do all across the country that will reduce the risk of either contracting or being exposed to the coronavirus. Yes,
Vice President, on the economic package, the word unveiled was just used, but so far the public has not seen it.
Mm-hmm.
How big is this package? How big is the payroll tax cut going to be? When is the general public going to see what you all have put together?
Right. Larry?
We are working out details right now, so I don't want to quote any numbers ahead of time. You know, you make a proposal, we're checking with the leaders of both parties in both houses and see what is doable and where the tough nuts are going to be. So I don't want to get into any detail. I think the outline of the thing is very important. The payroll tax holiday is probably the most important, powerful piece of this. But on the other hand, I want to draw attention. We can use administration and executive authority, again, to help unpaid sick leave people, which is very important. We can use it for the medium and smaller businesses, which is very important. Other distressed sectors, we have some leverage on tax deferral. We know, I mean, look, I will say again, as I have for quite some time, the economy is strong. We also know there are going to be problems ahead. We know there are going to be challenges ahead. Don't deny it. We'll see. I want to take that a day at a time and a fact at a time, a statistical release at a time. But anyway, this will be the broad package, and at some point in the near future, we will outline a more detailed package for you.
Great. Good. John?
Actually, maybe while Larry's still up there, unless you want to answer it, Mr. Vice President.
Go right ahead.
The President proposed to the GOP policy lunch today to remove the entire payroll tax from both employers and employees. That would be a 12.4% reduction. Back in 2010, we had a 2% reduction. Can you basically eliminate, for however number of months, the payroll tax without blowing a huge hole in the budget? And furthermore, the President told the lunch he'd like to make that cut permanent. How do you do that?
You know, the payroll tax holiday is a bold move. It's a very bold move. And this has always been a bold president. And we've been cutting taxes and rolling back regulations and changing trade deals and opening up the energy sector and doing things that nobody thought we could do before, John. We've had pretty good economic results for it. We're in a challenge period now. I get that. So with respect to your question on the specifics, I think there'll be a big growth payoff. I think it'll help deal with whatever challenges occur in the next few months. I think beyond that, ameliorating the tax burden on the middle class, the so-called blue-collar boom that I talk quite a bit about, that's what this is aimed for. That's really what the payroll tax is principally about. By lifting the burdens of those middle-class folks, I think we're going to get a big growth kicker. We've had a terrifically strong labor market, as you know. It may stall a bit or not. I'm just speculating on the challenges on the health side. But I think over time, we'll make it up with much better economic growth. And I will remind also that later on, way down the road, probably later this summer, early fall, we will unveil another package of tax cut and tax reform proposals. But yeah, it's a bold proposal, and this is a bold president, and I think it's paid off.
If you were to make it permanent, can you backfill from general revenue to make up for, I mean, in fiscal year 21, Social Security, unemployment insurance, and Medicare Part A revenues are $1.23 trillion. Can you find that money somewhere else?
I just say we're not talking about Medicare at this point. I'm going to, by the way, the answer is yes, you can backfill it. And that has been done before because we've had other payroll tax cuts, and you mentioned one of them in 2010 or 2011. So the answer to that is yes, and the answer is we will always maintain a solvent Social Security system. But, you know, tax reform is very important. Economic growth is very important. Incentives for middle and lower income workers are very important. And I will just add, you know, in terms of the boldness of this president's policies, despite what some of our critics think, actually it's the middle and lower middle people that have done the best in wage growth terms. And I think this is absolutely consistent. This lifts tax burdens on the middle class. I think it's absolutely consistent with his earlier policies.
And let me also say, John, if I can, that the other piece of this is what the doctors have said to us, what the experts have said is, if you're sick, if you have reason to suspect that you may have coronavirus, we want you to stay home. And the president's absolutely adamant, working with the Congress or using his executive authority to ensure that hourly workers, people working for small or medium-sized businesses that don't currently have paid family leave, will be able to stay home and be confident that they're not losing a paycheck. I think every American can identify with that concern, and we're going to work forward, whether we do it legislatively or the president has some resources in his executive authority to act. We're going to work to make sure that hourly workers don't feel like you have to go to work sick because you're risking a paycheck. Get home, stay home, take those couple of weeks to get better. Eamon.
Thank you, Mr. Vice President. I want to drill down on something that Larry just said, though, because in 2018, according to the Center for Budget and Policy Priorities, federal payroll taxes generated $1.17 trillion, which is an enormous figure. And Larry, you're suggesting that you can make that up from general revenue. Where are you going to get $1 trillion from?
You know, let us put the proposal out in concrete details and flesh that out, and we'll have much better answers. Right now, I want to stay in my lane, and I think the health story, the coronavirus story, is very, very important here. We will do the best we can, Eamon, to give you specific plans and details once we flesh them out.
Yes, please.
About the increased testing capacity. We're still seeing reports of severe rationing in many cases because of the limited supply. It appears to be close to impossible for average Americans to get tested without being hospitalized first. So when can the American people expect to see these test kits available at doctors' offices, at urgent care, at minute clinics, that sort of thing? Specifically when?
Well, I'm going to have the Secretary step forward and address that, but let me say we've made great progress over the last week. 1 million tests are in the field. Every state lab in America can do coronavirus tests. If you're concerned that you have coronavirus, your doctor can contact the state lab, can have a test processed. By the end of this week, another 4 million tests will be distributed. But to your very important question, we're working day by day with the largest commercial labs in America. We had some good discussions today with outside experts as well, who said that when the president brought the commercial labs in, he did exactly the right thing, because it's those big companies that have logistics infrastructure all over the country, have labs all over the country, that can distribute the tests, process the tests, whether it's Quest or whether it's LabCorp. And we believe that in the days and weeks ahead, we're going to continue to see the availability of tests dramatically rise, and we're driving toward that every day. Mr. Secretary, did you want to add to that?
Sure, maybe Dr. Redfield can add in also. So by the end of this weekend, we had 1.1 million tests that were actually shipped. We have another 1 million that are either in transit or waiting for orders. So we actually have a surplus capacity already of tests that have been produced. And as the Vice President said, by the end of this week, be another 4 million tests. So the tests are out there. The tests are in every public health lab in the country. They're in hospitals. They're in labs. But I think there's a false premise in your question, which is the notion that just because I, as a person, say, oh, I'd like to be tested for the novel coronavirus, I should be going to a minute clinic or some other facility and just walking in saying, give me my test, please. That's not how diagnostic testing works in the United States, or frankly almost anywhere in the world.
Trump said on Friday, said anyone who wants
It's
to get
always,
tested can get tested.
if their doctor, we've always been clear, if their doctor or public health physician believes they should be tested, it needs to always be clinically indicated to receive a test. So it's a false premise. Go to your doctor if you first. Actually, don't go to your doctor. Call your doctor's office if you believe you may have the novel coronavirus. Call the clinic, call the hospital, call the doctor's office so that you don't just walk right in, follow their infection control procedures for doing that, and then they will decide, working with you, whether a test is appropriate to be done. But there are millions of tests out there now, and it's going to, as the Vice President said, with Quest and LabCorp getting it at the doctor's office, swabbing their distribution and transport system, it's going to be an even better, closer to the patient experience, as I talked to you on Saturday when we met together.
That's very good. And Answer, I'm going to ask Dr. Birx to speak to this too, because she's just done a tremendous job bringing our commercial labs to bear on this. But to your other point, the President directed us to essentially change the criteria that CDC was giving labs around the country. We heard from governors around the country that people that were only mildly symptomatic were being told that they couldn't be tested. We changed that. We changed that description. And so, as the President said, anyone who, on a doctor's order, wants to be tested can, at a doctor's indication, be tested now. We're working to fill that need, and we're making great progress every single day. But I wanted Dr. Birx to speak to it as well.
Yeah, I just wanted to talk to you briefly about what happened in decreasing barriers. I've been a lab person, I've been a vaccine developer, I've been a doctor, I've been all those things, but I've never in my lifetime of government service have worked with the CDC in a way that every time the state or local government calls and says, I have this barrier, I need a modification to the regulations. That has happened almost daily. And the reason we have commercial labs willing to step in immediately is because the FDA has created that ability and posted on their website, I don't know if you've been there, this unbelievable waiver system and the clear definitions where every single hospital, every single university can utilize this testing algorithm. And that's highly unusual, but it's also what's bringing the super large high throughput companies to the table. And I just want to, this has been unique for me to be able to see this unbelievable dialogue between what states need, what local governments need, and federal government being responsive with changing those regulations. And that has been really wonderful to watch.
Thank you, Dr. Birx. Can I get you right here?
Yes, I wanted to ask, I guess the administration has really touted the success of the travel ban on China and Iran. Why has it not extended those bans to South Korea or Japan or Italy? And is it still under consideration, or has the administration really shifted to mitigation from containment?
Well, I'm going to let Dr. Birx speak to that in a moment. But there is no question, as Dr. Fauci said just a few days ago, we would be in a very different place if President Trump had not suspended all travel from China. And we would also, I suspect, be in a very different place if we hadn't issued travel advisories for portions of Italy, portions of South Korea, and initiated screening of all passengers on all direct flights into the United States from both of those countries. I will tell you, we had a very thorough discussion today of the prospect of recommending to the President additional travel advisories. What we're doing, particularly as Dr. Fauci said, is we're following the facts, and we're going to bring those recommendations forward in the time and manner that we, as the White House Coronavirus Task Force, determine are appropriate. But let me tell you, it is literally a day-to-day consideration, and we're going to continue to put the health and safety of America first. Dr. Birx, did you want to amplify that? Or
I think that was perfectly said.
Dr. Fauci, did you want to?
Thank you. Tom Bossert, who used to be a part of this administration, had an op-ed where he basically said that the U.S. has 10 days before hospitals could be overrun. He recommended that schools be shut down for maybe 8 weeks. What does the administration think about that? Does it agree that the U.S. could be at the point where there could be a turning point in the next 10 days or so? And what about keeping schools open? Should they be kept open?
Well, let me say the recommendations that you have and that every American now has at coronavirus.gov apply to every jurisdiction in the country, every state and every community, irrespective of whether or not there's been a coronavirus case established. I will tell you that we're working very closely with California, Washington, New York, Florida, to develop community-specific recommendations for those areas where we have had what is known as community spread, a number of coronavirus cases that appear that it's being transmitted in the community. In the next 24 hours, working with those states, we'll be publishing CDC's recommendations for what ought to be done. But I want to turn it over to Dr. Fauci to tell you that we really think the most important thing here is that we continue to bring the facts forward to the American people, and that our proposals and our recommendations, well, all of these apply to everybody in the United States, and it'll help reduce the infection rate of the coronavirus. That for those communities that are being impacted, we're going to develop specific recommendations that'll make the most sense for them. Dr. Fauci?
Thank you. And Dr. Fauci, can you say can you wait until there's community spread to make some of these decisions?
Well, it depends on the degree of community spread. I mean, community spread could be just a small amount, or you could start to see multiple generations. But getting to your individual question, that everything is on the table for consideration. So the idea that we're not closing all, I think for the country right now to say we're going to close all the schools in the country, I don't think would be appropriate. Would school closures be appropriate depending upon not whether you have already the horses out of the barn, but when you start to see we're getting a little bit dangerous here, so let's do it. So it's incorrect to say now everything has happened bad, let's close the school, and it's incorrect to say let's just blanket close the schools in the entire country tonight. I don't think that would be appropriate, but I do think it would be appropriate to carefully try and do things like closing, but there's other things besides closing, to do real mitigation sometime before you think you really need it. That gets back to what I said a few moments ago about where the puck is going to be. But you want to make sure you're not so far ahead that you overshoot.
Great.
All right, thanks, guys.
Just real quick, should the president stop shaking hands with people? He just did it at the Medal of Freedom ceremony a few moments ago. On this sign up here, it says you should stop handshaking if you're at your workplace, in your school, or in commercial establishments. Should the president set that example? I notice you've been opting for the elbow bump.
I've been shaking hands too.
What do you make of that? Is that necessary, do you think, at this point?
Well, look, as the president has said, in our line of work, you shake hands when someone wants to shake your hand, and I expect the president will continue to do that. I'll continue to do it. What this is a broad recommendation for Americans, but a really good recommendation is to wash your hands often. And all the experts tell me that while people want to get the various sanitizing lotions, washing your hands with hot soap and water for 20 seconds is just as good as any lotion you can buy. So, how about right there? How about one or two more?
So is it a plan to coordinate a response with other countries?
I'm sorry, say again?
Is it a plan to coordinate a response with other countries in the continent? President Trump met President from Brazil, Bolsonaro, this weekend. Did they talk about coronavirus?
I know that they spoke about a broad range of issues, and I'm confident the coronavirus was discussed. What I can tell you is that our focus is on the health and well-being of the American people. We're going to continue to communicate with nations across this hemisphere and across the country. But what the President's given us as a mission of the White House Coronavirus Task Force is to see to the health and well-being of the American people, and we'll continue to make recommendations to do just that. How about one more?
Thank you, Mr. Vice President. Two questions. One on Washington State, they made a request of the strategic stockpile for, they said 233,000 masks, and they received half of that. Wondering if that report is inaccurate, please speak to it. And secondly, on cruise lines, are you looking at a bailout for cruise lines? Several of these companies are tax exempt.
So they got half of the shipment from the Strategic National Stockpile initially, and then when the Vice President actually went out to the state of Washington, that's when the second half of the shipment arrived. But I have spoken directly with Governor Inslee, with whom we've had a superb working relationship, and he has informed me that there are some additional personal protective equipment needs that a couple of their hospitals have, and we're working through the Strategic National Stockpile to make sure we are directing and fulfilling shipments to them as needed.
I want to echo again our gratitude to Governor Inslee and all the health officials in the state of Washington. I was there last week. Our teams are working very closely together. We'll follow up on that public report, but the Secretary's indicated. But look, we're, as I said, in the next 24 hours, we'll be working with not only Washington State, but California, with New York, with Florida, and unveiling our recommendations, CDC's recommendations, to those areas that have been impacted by community spread, and then we'll continue to come alongside those communities to do everything in our power to mitigate the spread. But let me just say again, as a resource, thank you all. We'll be back here again tomorrow. Coronavirus.gov, practical information for every American, details for state labs that may yet have questions about performing their own tests. We have specifics, enzymes, agents, ingredients that where they can be acquired and how for the performance of coronavirus tests. But for every American, I just want to say again, remember the risk to the average American of contracting the coronavirus remains low. But however, the risk to senior citizens with serious underlying chronic health conditions is very significant, and it's important for all of us to continue to take all the steps necessary to look after the most vulnerable, to look after our health, and I'm confident that we'll get through this together. Thank you.